Doctor, good morning. It is a beautiful spring morning here in East Texas. I'm sure you, like me, are starting to see some redbuds and some little peaks of spring, forsythia. You're starting to see the signs of the beautiful sunshine bringing out the best in the beautiful plants that God put on this earth. So here we are feeling a little extra happy and a little bit more alive because of that wonderful spring and its sunshine and its flowers. And today I wanted to talk a little bit about one of my topics that you know is a big deal with me, and that is how corporations, insurance companies, government, Medicaid, Medicare, have impacted and gotten into our dental practices. I've been doing these medical things for a long time. First, I went to nursing school, as most of you know. And then, after about 5-6 years of practicing as a nurse, critical care nurse, ICU, CCU, and administrative roles, assistant director in a very large 1,000-bed hospital in New York City, I went to dental school. And so I want to talk to you about some of my experiences with these very corporations and my awarenesses of them over the years. So let me tell you a few stories. Number one, what happened in 1969 or so, as I recall, we student nurses were so excited about the fact that there were patients, elderly patients in our hospital that suddenly had insurance coverage called Medicare. It covered all of them. And by the way, granted I was a student nurse, but it was my impression, and it still is, that it covered pretty much everything that they needed as based on what the doctors decided, the physicians decided their needs were. It covered diagnostics. It covered all sorts of treatments. It covered prevention. It was a pretty darn good situation for the elderly patients. And we were pretty excited for them because, you know, it was nice to see them getting the care that they needed. And you always love these little old people that are a little more vulnerable and sweet, and they've raised families and their grandparents, and it was a nice thing. It was great. Now, that was the beginning, I guess, of Medicare. Other corporations were starting to cover medical treatment a little bit. But let me tell you a couple of things. There weren't a whole lot of medical insurances covering a whole lot of the typical patient care and needs. There was some. For example, interestingly, when I was a student nurse, we didn't have any medical insurance. You know what happened? The doctors, the physicians, and the dentists, because our hospital happened to have a dental department with residents, actually offered 100% courtesy to students, nursing students, to dental residents, to nursing staff, and to each other on the medical staff. I'm talking about the hospital and the physicians, the practitioners. 100% professional courtesy because you were part of the family. Think about that. It was interesting because as we were needing something, it was taken care of. When I, working in a hospital several years later, needed some care, I had a viral optic neuritis, which was a hospital-based nosocomial infection. Guess what? 100% coverage. By then I had a little bit of medical coverage for the hospitalization, but the physicians didn't charge me a penny. They professional courtesied it. And the hospital, anything that wasn't covered, didn't charge. Now, that was the system. And it was a system because there was not a corporation peeling off a percentage, small to large, of the money that they needed to make and were making by being the consummate professionals that they were. So that's what they did, and that's how it worked. And I remember when I gave birth to my oldest son, I remember I had no OBGYN coverage, none, zip. I didn't need it. I was a supervisor, nursing supervisor in that hospital, and the hospital did not charge me for my delivery, labor and delivery fees. My obstetrician who I worked with did not charge me. In fact, I remember that my husband and I gave him a beautiful lithograph later to say thank you for the wonderful care that he had given me. So this is how it used to work. It was based on love and mutual respect. And it was a wonderful system. We can't do that now. We couldn't afford that. Hospitals can't afford it. Doctors can't afford it. It won't work because corporations are taking out such a huge percentage of the money that's being generated, so to speak. Healthcare is huge. Look around your neighborhood. Look at the hospitals. Look at the medical centers. Look at the doctor's offices. Look at everything that goes into healthcare. It's one of the biggest money-making enterprises in the world. But the money's not being made any longer by the individual practitioners who are giving of themselves totally. No. It's being made by corporations. And sometimes hospitals are one of those corporations, but that's how it goes. I remember when I first started dental school that there was very little dental insurance for our patients, or that they had very little. We didn't have to worry about that. We told them the fees, we worked with them and set up payment plans, and there was a department, of course, that went to collect it, and I'm sure they lost a good bit. You know what? I bet it wasn't as much as the insurance companies peel off right now. Now, in dental schools, you may not treat a patient if they don't have insurance coverage for X, Y, and Z, or if they haven't paid their fees. You may not, in most schools, you may not even treat a fellow student. You may not even treat your family members. That is just plain not allowed because there's no money to be made, and we need money to survive as an educational institution. So it's changed a lot. I remember when Walter Doyle, my partner, at the time was on board of Delta Dental. It was an early corporation set out to help the dentists, to be able to make money and yet have some help for their patients with coverage. Delta Dental, dentists felt like Delta Dental, and they were partnering for the patient's well-being. And Delta Dental and the dentist could make some money. And that was true at first, apparently, although I wasn't privy to a lot of the early years. Now in Washington State, there's a lawsuit among Washington State dentists suing Delta Dental because they think that there's still a partnership and that it should be different. Guess what? It has changed radically, and they didn't get the message. Nobody sent them the email. Delta Dental, just like all the other big corporations, wants all the money they can make, and they are not partnering. They are not concerned about the patient's well-being. They are not in relationship. They are in corporations, which, thank goodness for capitalism and corporations. We need to have money-making opportunities, and we're thrilled to be in practice ourselves. But the bottom line is, it's changed radically. Think about some of this. Think about some of what you can do. Think about how you can look at this, and think about if you want to be involved with the corporations, or if you want to take your show on the road and love your patients completely outside of the third-party relationship. Think about that. Have a good day. Think hard. Make good decisions. Love you. Signing off.